Assalamualaikum everyone, welcome back to this channel. So this is me Alia Wahid, and in this video we are going to start the second part of a drug which are treating the cough. So in the first part we have discussed about what are the mechanism of cough and what are the drugs which are used for it, like antitussive drugs. We have discussed all of them. We have discussed the mechanism of action of mucolytics. So now we are discussing what are the drugs which are acting as mucolytics. Muco word mean mucus and lytics mean breakdown. So actually they are breaking down your mucus. So two drugs are used for that purpose. One is bromohexine and second is acetyl cysteine. So bromohexine is causing the low viscosity of the mucus so that it is easy to expel the mucus out of it, out of our body, out of our respiratory tract. So actually, it is used to treat various kind of diseases like bronchitis. It is a disease in which walls of bronchioles are become thickened. It also used in the post-operatic and post-traumatic pulmonary complications. So most of the pulmonary complications happens after a trauma, after injury. So a second thing, it also used to treat chronic sinusitis, mean chronic kind of inflammation inside your respiratory tract. So the bromohexine will be given in all of these situations and it will treat them. Second drug is acetylcysteine. So it is also decreasing the viscosity. Pharmacokinetics is that it can be given orally or also given in the inhalation form. So aerosols are used of acetylcysteine. So they are used in order to provide the relief. So mechanism is that this acetylcysteine contain free sulfahydryl groups like sulfahydryl are SH group. So they break the disulfide bonds in the mucus. So in the previous lecture we have discussed that is the structure of a mucus, that it contains various kind of bonds like disulfide bond, hydrogen bond, and intra van der Waals forces are present between them. So actually we need to break these bonds. So the acetylcysteine is breaking this bond and diluting your mucus. So it also acts as an antioxidant because it is decreasing the free radical of oxygen. So it also has antioxidant activity. So due to antioxidant activity, it also helps to reduce the inflammation which is present in your respiratory tract. Now we have covered all about the mucolytics. Now we will discuss the expectorant. So expectorant are also called as mucokinetics. Muco word mean mucus and kinetics mean movement. So now we have to increase the volume of mucus, we have to decrease its viscosity. So in the mucolytics, we are not increasing the volume of mucus, we are only decreasing its viscosity. But here we also increase its volume, it's decrease its viscosity, and this expectorant will be given when a patient have chronic cough. So they are going to treat the chronic cough, not the acute cough. So in the case of acute cough, you will give mucolytics, you will give antitussive drugs or other drugs. But if the patient have chronic cough, then you will go for a good expectorant. Now let's discuss what are the drugs which are acting as a expectorant and they are moving the expectorant out of your body. So here I have given the drugs which are acting as expectorant. The first drug is sodium potassium citrate and or acetates. Means sodium citrate or potassium citrate, and it can also be called as sodium acetate and potassium acetates. So they are used to treat the acute bronchitis. Bronchitis being the inflammation in bronchioles. So when the inflammation is at the acute state, then we give these drugs like sodium acetate and potassium acetates and something else. So what is their mechanism? Actually is the sodium and potassium, they are the acting as a solute, they are the salts. So when the salt concentration increase in your body, the body will produce more and more water secretion. So when the solute like sodium and potassium they increases in your bronchioles, then your bronchiole cells will sense it and they will going to release more mucus. So as a result, volume of mucus will increase out, which is the exact purpose of the expectorant, to increase the volume of mucus. Now let's discuss the second type of expectorant, which is nauseant expectorant. So in nauseant expectorant, these drugs are used. First drug is epicecania. It is also used to induce the emesis, and second is the ammonium salt. Actually, they have no direct action or as an expectorant. They have indirectly acting as an expectorant. So actually they are going to stimulate some sensory nerve sending which is present in the stomach. So as a result they also stimulate your cough centers, and they also increase or start the coughing. So due to cough the mucus secretions increases. Third expectorant is a iodide. So iodides can be sodium iodide and potassium iodide. So they have two effects. First is the expectorant effect, and second is the mucolytic effect. Let's discuss expectorant effect. So actually these iodides accumulate in your bronchial glands, and due to the accumulation of iodide here, the watery mucus will again increases its production. So and your iodide also has a second action which is used to treat the hypothyroidism. So when a patient whose hyper thyroid gland begin to work overstimulated, so when your thyroid gland overproduce the thyroxine and the T3 and T4 and T3 hormones, then we will give iodides to that patient. But iodides have very low kind of effect that we cannot give these to the patient for a long time because of their a lot of adverse effect. We will also discuss their adverse effect. Their second effect is a mucolytics effect, that actually they increase the effect of proteolytic enzymes. Proteolytic enzymes are useful for the breakdown of mucus in the mucosa. So when the protein present in the mucus is breakdown, then it will liquefy it and increase their volume. So here I have written some adverse effect of iodides, which is it has a metallic taste. So due to very bad taste, the patient in compliance patient cannot take these iodides. Second, it also you cause the ulcer in the mucosa, so therefore it is producing the sore in the wall of stomach or in the wall of intestines, therefore they are cannot be used for a long time. They also irritate or increase the secretions of all the glands which are present in your body. And what are the glands? Like lacrimal gland and salivary gland, so they increase their secretion. They also irritate the gastric mucosa. They cause thyroid dysfunction when we use it for a long time. So you can place thyroid dysfunction as its toxicity. So when you use iodides more than its prescription, then it will cause hyperthyroidism. It will decrease the secretion of thyroid gland. As a result, your thyroid gland dysfunctions happen, that your thyroid gland will not work properly. Lastly, it will cause some kind of adverse reaction in your body. Now, the fourth drug is the guanifacine. So, it is centrally acting muscle relaxant. So, it is not increasing the volume of your mucus. Actually, it helps to clear the airway by increasing the bronchial movement. So, it will increase the contraction or relaxation of bronchioles. Due to increase in this movement, it will push the mucus to move forward. Like if I am saying that this is a bronchiole, now it will really increase its movement. Now due to increase in the contraction or relaxation, the mucus which stick here begin to move forward. So this was actually the mechanism of guanifacine. Let's discuss the next type of expectorant.